he had turned out to be neuroclaudication or a derangement compared to this vascular situation, what would treatment have looked like? What would your role have been if he had shown to be neuroclaudication, where you could make him worse but not better?
So I do a lot of education. And again, you're not going to see many of these. If you're seeing these come into your office every day or every week, I would say you need to go back and reassess.
Yep.
So I may see these once or twice a year.
Yep.
So true stenosis, we do a lot of just education. Hey, we understand it. You know, a lot of them don't want surgery for it. They've learned to adapt to it. So I had a lady that walked the mall. That was her exercise. So she would sit on the bench after so long as she started to feel it in the legs, have a seat. There is, based on the clinical practice guidelines, mobility. So even stretching the thoracic, working on mobility there and the hips can kind of open the area up and hopefully allow at least they can get further before they start feeling the symptoms. So a lot of that just, hey, let's stretch, let's be mobile. I would say symptoms do not mean harm in all cases, as long as it's able to settle back down. So a lot of just avoiding fear avoidance. We need you to stay active. We need you to understand what's going on with your body. And also a lot of them have already seen neuro at this point. So they've either been told, hey, you're not a surgical candidate, or a lot of them just don't want to go through surgery for this. I mean, it's a big deal. I'm older in age. I've learned to adapt, that kind of thing.
Yeah. And that may be obvious to us, but just talk through your role if it had turned out to be a derangement.
Find the directional preference. I always say seek and destroy, like everyone else. Find what it is. You know, I find that older people typically will do better in a weight bearing, such as standing extension. You could do that at the kitchen counter, at the mat, in your office. A sustained extension does really well. So lying there, arms propped up on some pillows, if they have foam cushions for their couch, a lot of them actually love the sustained portion of it. They can kind of lay there, let everything settle, but they don't have to keep progressing to it. And of course, you could do it extension aligned, according to how they benefit from it. I've had some people just even put, and if they felt a little bit like, let's say, hey, I do feel it. We are able to find a derangement. They said they never felt it was sitting, but, you know, using a lumbar roll to put them to maintain those corrections over time may be beneficial. If they're older, they can get the end range a lot quicker. So sometimes just those little bit of changes in range of motion really do help pretty quickly.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.